The Embassy of Health is looking into what design could mean and do for health and healthcare. The role of designers is to start a discussion with healthcare professionals and with patients and with hospitals to really change this world. Healthcare is a closed system and it's very much depending on healthcare professionals, the organization, the institutes. And I think projects here are examples of taking control and taking matter in their own hands. The Ivory Walk by Alisa Reis is an example, I think, that comes straight from the heart. Because Alisa herself got leukemia on the age of 19. And so from one day to another, she was suddenly a patient. And she was attached to the IV pole. And she came up with an idea to make a kind of backpack with all the stuff which is normally on the IV pole is now in this bag. Which means that it's much easier to walk around, which also improves your recovery. Within the team of Utopian Future, we have the work of Frank Koopman called Autospector, and we gave him the theme of the end of life. When he did his research, he came across people who had an out-of-body experience and they felt less fear of death. So he came up with a virtual reality installation and it gives you the out-of-body experience. You are wearing the VR headset and at the same time a head behind you which has two cameras in the eyes and has a microphone in the ears is moving away from you. So you see yourself through the eyes of this head. And at the end of the track it's slowly going down and it's coming back into your body again. What Frank Koopman tries to do with Autospector is to diminish the fear of death. With his open surgery robotic arm, this is much more about questioning the existing healthcare system. In the US, and it's also starting in other parts of Europe, is that healthcare becomes so expensive that people cannot afford a surgery. So they look online, trying to find ways to do surgery themselves. And what is shown at the exhibition is based upon the Da Vinci robot arm, which costs €500,000, so it's very expensive. He looked to see if he could build it in a cheaper way. And he built together his own surgery arm. He's talking with policymakers and healthcare organizations to start to look differently at healthcare. In design, we're talking about patents a lot. So you make something, you close it down, and you sell it. Open design is sharing your knowledge on design with others as well. And if we share this kind of design, could we change it into a much better world? So an exhibition like this is a kind of seed. It resonates with a lot of people who are entering here. Either patients, healthcare professionals, but also big commercial organizations as well.